Imagine you all of a sudden you over push him or over pull him, what will happen? We talk about lockjaw. How do you differentiate a lockjaw? Normally lockjaw will end up like this. Touch your shoulder, he couldn't touch, and then he starts shivering a bit. How you press everything, how you push also, it's just there. And then you touch here, you feel very hardened, very stiff, very hard, very hardened. Okay, this is called lockjaw. One, he never treat the elbow misalignment, so he leave the problem there. And then slowly he just recover, and then end up like this. Number two, he got treatment but never cured properly. Number three, he went for a surgery. So there's a lock here, there's a screw here. Okay, after everything screw, when he tried to pull his arm like that, but this one he can stretch up, he can move, but only here is also lockjaw. Imagine you all of a sudden you over push him or over pull him, what will happen? The screw might crack, loose off. They have to go for a second surgery then to unscrew and screw it back again. So do not end up into this scenario. Okay? Bear in mind. Just do some manipulation, help him to do stretching. That means you help him to strengthen it. Train his muscles, his tendon into flexibility. Because it's locked already, you gotta train, like physio like that. You got to help him do stretching. You got to ask him his history of injury. When was it? If he say, oh, yesterday I have a fall, so I end up my hand like that. Possible this is misalignment. If the alignment has been done correctly during his injury, he shouldn't have ended up with lockjaw.